Christmas, a very Merry Christmas to you, and if it's after Christmas, a very Happy New Year and all the best for 2014. I'm here today in the Children's Assessment Unit of the Treehouse Children's Unit at Stepping Hill Hospital. We see around 6,000 inpatients and 20,000 outpatients, and the assessment unit means that children can sometimes stay quite a short period, be given immediate intervention, allowed to go home, or if necessary can undertake diagnostics to decide how we can best care for them. They're a really dedicated staff, and I wish them and the children and their families a hugely happy Christmas. We've seen a couple of national surveys coming out in this last month, and one of those is the Dr. Foster Hospital Guide. That was particularly looking at mortality and weekend mortality, where most hospitals in the country unfortunately show a higher mortality rate at weekends. In terms of the overall standardised mortality rate, we're as expected for a hospital. We're in a good position. However, in terms of weekend mortality, we've got some improvements to make, and our hospital mortality rate stands at 113, whereas it should be much closer to the 100 mark. We've got a plan being put in place to improve that, including things like more consultants and senior doctors, more therapists on at weekends, so there is no lull in the activity or decision making for patients. Another publication which came out was Never events. These are events which are described as being preventable, which should not occur in hospitals. And unfortunately, along with 103 other trusts within the country, we had a couple of the Never events in the period that they looked at, which was April to September 2013. The two that we had was a cardiology procedure where a swab was unfortunately left inside a patient and later taken out, and the other was in ophthalmology, where the lens strength for a patient having a cataract operation was not correct. We've learnt lessons from both of those, changed our systems and procedures, and we hope never to see a repeat here. Last year we saw no Never events, but that's not a reason for complacency. We need to ensure that we don't have them, and if unfortunately we do, we take full learning and make changes. One of the longest conversations at the recent Board of Directors meeting was around car parking charges, and after much debate we unfortunately felt that we had to increase charges both for visitors and patients, but also for our staff. This will then bring our charges into line with other trusts within the North West region. We haven't actually put car parking charges up for 4 years, and we have got additional costs in terms of security and maintenance. We have got the charge information on our website, and a principle was also accepted that our community staff, who are often parking in areas that we as an organisation have to pay a rental on, will also have to contribute to the cost of car parking charges. Last month I told you about the quiet bins, something that patients commented on in our patient survey, particularly at night time, where staff were using old-fashioned metal bins, and we're now in the process of replacing those with the quiet closing bins. We've also been listening to patients and their families about food, and in some areas the temperature of food was not as warm as it should be. So we have now invested in brand new food trolleys. Those are beginning to be literally rolled out onto the wards this month and will continue into January, and we very much hope that in listening to you we will ensure that not only the quality of the food is good, but the temperature of the food when it's being served is also excellent. I am so proud of two of our nurses in particular who have won the very prestigious Queen's Award. Their names are Dawn Bennett-Painter and Jane Etches. They both work in community aspects, one in Stockport and one in Hyde, and our commendations and thanks go to them. I hope they are a role model for all of our nursing staff who already provide excellent care and can go on to be recognised in this kind of manner. Two other areas of awards. Firstly, thank you to Stockport Council, who in their Young Stars Awards have commended with an award our team that look after apprenticeships and other younger people's developments. So thank you to them and to the team. And secondly, the communications team have won 2 awards, one as Team of the Year and the other one for the website. I would just like to say thank you to the comms team who are very much managing things like this podcast, the team brief and the intranet and internet. So thank you to them. I would now like to say again a very, very happy Christmas. I hope that any of you who have used our services in the year will thank with me the dedicated and absolutely award-winning staff that we've got throughout the whole organisation. And if you are unfortunately without good health at all next year, I hope we are there for you. Instead, I wish you a very happy and healthy Christmas and 2014.